Alright, here it is. This is my first commentary on some overall mobility training. I wanted to just journal and document what a sample warm-up might look like from start to finish, so here it is. Today was a leg day, and on that day, I always start off with a good warm-up. Even though in this video I'll loosen up other areas other than just my legs, I address tight spots in all of my workouts with deep tissue work and mobility. Having worked with an athletic trainer, this banded hammy kick's almost protocol when training athletes. Hamstring strains are some of the most common sports injuries, and even though some of us are over here just trying to get a better body not playing a sport, if you don't warm up properly, you could easily pull something. It's very common to get pain in your lower back, fatigue quicker, and have strength imbalances. So loosening up those hamstrings can save you from having a slew of other problems. What you're looking at now are TKEs, clinically known as terminal knee extensions. This is pretty much a pre- and rehabilitation exercise. Doctors and therapists are frequently recommending this after knee injury or surgery. If they're not, they absolutely should be. This is the safest exercise you can perform to strengthen the final degrees of extension in the quadriceps area, mainly feeling the vastus lateralis, medialis, and also rectus femoris. This is a great exercise to restore mobility and strength to a painful knee. If you feel pain or swelling while doing this, stop or reduce the exercise until it subsides. This generally puts absolutely zero pressure on the knee. The next best thing to try after this would be implementing some foam rolling along the quadriceps. After spending at least 5 minutes rolling out all parts of both legs, I would then try and perform a reverse lunge. That exercise greatly minimizes the chance of putting excessive forward pressure on the knee. If you don't know how to do a reverse lunge, make sure you click on my video at the end of this one for the step-by-step breakdown on how to perform one. Foam rolling your legs is the meat and potatoes of getting rid of knee pain if you have it, and tight muscles in your legs, which you have because just about everybody does. Does this feel great? Not at all. But will you feel better afterwards? Absolutely. When I'm rolling my legs, I want to hit it from every angle, especially focusing not on the knee, but the area just above it to help alleviate any knee issues that may arise. You want to make sure you roll the outside, top, and inside part of the quadriceps towards the knee, fully extending and flexing the leg through all of its range of motion. This is the area that is generally the tightest and responsible for triggering the pain felt where the cartilage and soft tissue is. You can't roll out the meniscus and ligaments inside of the knee. Massage the muscle by applying very firm pressure, breaking up those knots and scar tissue around there. This can sometimes relieve that pain. The goal is to strengthen that area around the knee and increase stability. Rolling out your back can probably be one of the most relieving and relaxing things over time that you'll ever experience with a foam roller. In the beginning, you may experience a little discomfort, but over time, it'll become more soothing. Rolling on my back is pretty much a standard thing before I do any of my workouts. If you have lower back pain, do not try to roll out your lower back immediately. I would roll out the surrounding areas first, and I would also roll out the glutes, the calves, and around the hip flexors. The area where you experience the pain is not always why the muscle is irritated. If you've never thought about it, people in general have tight glutes. Most people sit down all day long in a chair or car and their hip flexors are shortened. This leads to a compressed spine, knee hip pain, and other movement dysfunction issues. It's important we lengthen, stretch, and massage these areas so we can exercise safely. Reducing and relieving pain is an important component of exercise to help us go about our day normally. I generally like to use a hard ball such as a Supernova from Rogue Fitness, or even Lacrosse ball. Rolling over the whole area throughout my glutes allows me to get better range of movements as I'm training my legs. It'll also reduce the chances of a lower back stiffening up while exercising. People do not get the full range of movement through exercise due to a tightness and a lack of mobility in their body. With enough pressure, rolling your lats, shoulders, and chest can be some painful stuff depending on how tight your muscles are. I slept on my shoulder wrong a few days prior to filming this, so I was trying to get a little work on my own before I saw my massage therapist. As you can see, this didn't feel good at all, but I promise you, the movement I had on my shoulder afterwards was greatly increased. If you just have a regular roller, you can roll the edge of it against all parts of your chest if you're a guy, especially up top. If you're a female, just roll out the shoulder joint and top portions of the chest. Make sure you're just getting the muscle and do this safely. For both men and women, rolling out your lats and shoulders are a must to help reduce any chance that your upper body can get excessively tight, as the shoulders are the default for stimulation when you're training anything upper body related. The goal is to be able to get that full range of motion as we're exercising. When using a hard massage ball, I like to roll out the entire area of the shoulders, especially the rotator cuff and the muscles surrounding them. If there's an adhesion in the muscles that is involved in rotation and movement, I want to massage this area firmly. These adhesions can cause weakness and make you more susceptible to injury. If the muscle isn't contracting evenly from end to end, you may experience discomfort or pain. It's very common for the rotator cuff to become impinged. You could have had a hard workout, slept on it wrong, maybe you just had bad posture and tight muscles from being sedentary, or you just don't do any mobility. Poor posture over time can cause impingements between tendons and muscles. When there is a pinching occurring between these areas, they become enlarged and inflamed. This causes a thickening of the area, possibly leading to more inflammation of other areas. Again, make sure you get proper diagnosis from a trainer certified in corrective exercise or a licensed massage therapist. What you've seen here is a general way to relieve some pain on your own, but if you don't know what you're doing, it's important to see a professional who can give you guidance on what to do specifically for your circumstances. If you need some tips on how to exercise correctly, please be sure to check out my videos at the end. Thanks for watching, and please take care of your body.